a blood vessel with, a tourniquet. You've got to have cannulas. If you think you need more than one cannula, you're not sure what size you need or something like that, take them in there, leave them in your pocket. Don't lay them everywhere, so the ones you don't use you can bring out of the room. You need tape. You will need an opsite or a tegaderm. And I think y'all have those in your kits also. So, you're going to try to explain to your patient what you're going to do. You do all the top things, provide for privacy. You're going to wash your hands. You know what I don't have is gloves. You're going to you've got to decide where you want to put your IV. So you're going to put the get the bed up to a working position, because you certainly don't want to be bending over to do this. Remember how you do this? You take it and put it around the circumference of whatever limb you're going to use, and what should you use? A hand to begin with. You start distal and move proximal. You want to use the upper extremity, the hand, if you can. Then you want to put the tourniquet around the circumference of whatever hand you're using. You're going to pull it tight, cross it over, and tuck one of the tails under, so that when you get done, you can just pull it and it'll come loose. You want it tight enough so that it's impeding venous flow, but not so tight that it's cutting off arterial flow. And then you're going to palpate to see which vessels pop up for you. Now you put the hand so that it's lower than the level of the heart, so you can have these things pop up. You can pat them, and your sense of feel will be more important to you than your vision. If you can feel that vessel popping up there, you can probably get a cannula in it. Now they will roll, so you have to be aware of that too. Once you decide where you're going to put it, and you can't cannulate or do a venous stick or any kind of stick on a side that has hemodialysis shot or a radical mastectomy done on it. There probably are other things too, but those are two of the main ones. Once you decide where you're going to go, then you can prepare what's going on. I take a towel in with me because I am messy. And if you get blood drips, it will go on the towel, and it won't go all over the sheets, so that you have to change all the sheets. Got it? All right. Then you're going to have to take your tape and tear it. I think Ms. Shager teaches you some way to not tear your tape, but I'm not sure how that's going to be. You're going to take one piece and tear it down the center, and you don't want to touch the center part of it any more than you have to, because that's going to go right up next to where you have stuck your patient. You get several pieces of tape torn off, so that once you get the IV in, you're not fiddling with tape to secure it. In the hospital, over there at Vaughn Regional, they have an IV cannula over there that you don't use tape on to begin with. The first thing you're going to put on it is the tegaderm. So it's just a little bit of a different setup than what you're learning here. But I've been to Baptist East, Baptist South, and they still use these little gel coat pipes. So you really need to know how to do a chevron too. Okay, so we're going to show you how to do a chevron. Once you get everything sort of set up so that you can get to everything, you get everything ready to rock and roll. What I usually do is take this and I will loosen this so I don't have to mess with it. Just get kind of loose and leave it sitting here. And I'll redo this. I don't like to leave my tourniquet on somebody for a real long period of time if I'm on a fiddle. And I don't like to tie my tourniquet with gloves on, because your gloves have the tendency to get stuck in the tourniquet. Then your finger's stuck in the tourniquet and your patient is losing confidence in you. every second as that's going on. Then I also loosen the cap here because you're going to have to quickly attach it to your IV cannula once it's in, and I like to have it a little bit loose because it's a little bit difficult to get apart. Now on the dolls, please don't open your alcohol wipe. These dolls don't do well with alcohol on them. It dries out the rubber. So if you would, just pretend like you've opened it. All right. Now you're going to have to learn to do it with gloves on, so my suggestion is you do it with gloves on. You will have to check off with gloves on. All right. So you're going to take it and you're going to cannulate. You found what you're going to cannulate. With your non-dominant hand, you're going to stretch the skin taut over the vessel you have decided to cannulate because it keeps the vessel from rolling and it doesn't let the skin bunch up as you try to cannulate it. So you're going to take where you're going to stick and you alcohol out in a circle, and I usually do that more than one time. And if I feel like I need to touch it one more time, and have on gloves, hopefully, that are tighter than this, because the tighter the glove is on your finger, the more tactile sense you have in the end of your finger. And if you touch it one more time, you alcohol again. All right? Then you're going to take this, and you're going to come in with the bevel up at a 20 to 30 degree angle. But I come in to the side of the vessel because that's just the way I was taught. You can come in over the top of it. It's just fine either way. I just happen to do it to the side. I'm going to come in to the side of this vessel. I'm going to go in, and then once I'm in the vessel, blood will flash back up into here. Then once I see that blood, I'm going to lower my cannula. I'm going to go in another about a 1/4 of an inch. Then I'm going to separate the cannula. I'm going to pull the stylet back a little bit and push the cannula in a little bit, and then I'm going to take it all the way to the skin. With me? Then I'm going to pop my tourniquet, and then I've got to hold this in some fashion while I get my tape, so I can't let go. Well, I'm going to do this first. I'm going to hold it here, and I'm going to open this up, pull this loose. Now, what's my finger back here doing? Okay, what I did was I held this here, and I popped this in, and I'm going to screw it in. Then I'm going to take this, now that I've got that accomplished, and I'm going to try to stick it right in there so it'll kind of be out of the way. Now, what I'm going to do is take this, and I can hold it here, and I'm going to take it. I'm going to come underneath with my tape, and you want to lay it on the hub of your cannula, under the hub of your cannula. This tape is sticky side up. I'm not hooking it to my tubing. I'm hooking it to my cannula. I'm taping it around my cannula. I'm going to make a little chevron like that. Now I can sort of let go a little bit. I don't want to let go much, but it's in there enough to where I can take this. I want to stand by real close though, and I'm going to lay this across, but I'm still not going to hook it to my tubing. Why do you think I don't want this over my tubing? I might have to change my tubing, and if I have all of this stuff over my tubing, I'll have to take all this tape and stuff off. And if I do that, what do I risk? I risk pulling that baby out of there, out of that. All right, I'm going to pull this off. And on here, there is a place for you to put the date, and then you could put the gauge of the cannula you used. Then I'm going to take this other slim piece of tape and come across here, and this time I am going across the tubing. Then I'm going to loop it back up the arm. Now I can actually do this. You could actually loop the arm up. Loop the tape before you put this on. saves you a piece of tape. Now you want this loop as tight as you can get it without crimping it, so that it's not this huge loop that your patient has to deal with as they function. And then you probably tape it again up the arm somewhere. And if you needed to, you could come across again. Most of the time, this is not a terribly convenient place to do it because it interferes with the fingers. And then you'd have to chart. And what kind of things would you chart?
IV site, needle gauge.
Where you did it, what gauge, what fluids, how fast. Those kind of things. Okay. Anybody have any questions? Most of that stuff is on that sheet. Just did I not go over something on the sheet? I can tell you something.
We just look and make sure.
Oh, I didn't
to see if I have a question.
You have to, once you get it in, you open the fluids and make sure they're dripping. You don't tape it down or anything. Once you connect your tubing and get it in, you have it in, you connect your tubing, and you've popped your cannula already, you open your fluids up some. You can't do it on the auto. You just have to state it. And make sure it's dripping, because if it's not dripping, you're not in good. If it's dripping and it's not swelling up down here or hurting your patient, you're in that vessel. Okay? So that comes right after you hook it in and pop your cannula. If you pop your tourniquet. If you open your fluids up with your cannula, with your tourniquet tied, you're going to blow your vessel because the fluids are not going to have anywhere to go. Does that make sense to everybody? All right, let's do the IM and section. All right, we'll have to go over all those sites. You have to have all your sites.